There has been a shortage of masks in the United States since the coronavirus started. This shortage specifically hit hospitals who need protective gear to protect healthcare workers so they can help even more people. Specifically, they need N95 masks. There were stories from the earliest days of the pandemic of doctors and nurses being forced to reuse these masks for weeks at a time or not having them at all and having to wear surgical masks or even homemade masks and bandanas. But in light of former vaccine official Rick Bright's whistleblower complaint, it's now been learned that there was an American company offering as early as January to set the country up with masks, warning the national stockpile was not going to be enough. Those early warnings and offers never materialized until April, after big contracts were awarded to large corporations to make masks. Michael Bowen heads a medical supply company, Prestige Ameritech, based outside Fort Worth, Texas. Getting orders for masks from as far away as Hong Kong, the day after the first known COVID-19 case in the U.S. was identified, January 22, Bowen made an offer to the Department of Health and Human Services to help the U.S. stock up for the pending coronavirus pandemic. He could increase his production to make an additional 1.7 million N95 masks weekly. He saw the lack of masks as a national security issue. "We still have 4 like new N95 manufacturing lines," he wrote to HHS administrators. Reactivating these machines would be very difficult and very expensive but could be achieved in a dire situation. He had communications over the next several days with senior agency officials and was left believing there wasn't much interest in his offer. "I don't believe we as a government are anywhere near answering those questions for you yet," HHS's Division of Critical Infrastructure Protection Director Laura Wolf replied. "We are the last major domestic mask company," Bowen wrote on January 23. "My phones are ringing now, so I don't need government business. I'm just letting you know that I can help you preserve our infrastructure if things ever get really bad. I'm a patriot first, businessman second." His offer was not utilized. Production lines that could be making more than 7 million masks a month are not being used, even today. This story was described in Bright's whistleblower complaint. As the former director of the Biomedical Advanced Research and Development Authority, he alleges he was let go in retaliation for not supporting Donald Trump's desire to utilize hydroxychloroquine and chloroquine and for trying to prioritize science and safety over political expediency. Bright pressed Robert Cadillac, the Assistant Secretary for Preparedness and Emergency Response, and other leaders in the agency about the mask shortage and Bowen's offer. He wrote to a deputy on January 26 that the warnings seemed to be falling on deaf ears. Bowen wrote to Bright one day later, "U.S. mask supply is at imminent risk. Rick, I think we're in deep sh. Just weeks later, there was a huge shortage of masks that put healthcare workers at risk, as the Trump administration started scrambling trying to find more. They bought some from third-party distributors paying much more than the usual going price. Trump was pressured to use executive powers to force manufacturers to make them." White House economic advisor and coronavirus task force member Peter Navarro said in a statement that Bowen's company was just extremely difficult to work and communicate with, and compared it to the National Council of Textile Organizations and companies like Honeywell and Parkdale Mills, which have helped America very rapidly build up the capacity of masks. Yet, a senior official with knowledge of the offer said Bowen has a legitimate beef, adding, "The reality is HHS didn't have the money to do it at that time." Another official blamed it on contracts not being a quick process. Bowen started studying BARDA, which was begun after the 9/11 attacks, looking for a way to make his warning about the shortage understood more than a decade ago. He concluded the focus of BARDA was on billion-dollar deals to create vaccines for more exotic disasters, including anthrax attacks and smallpox. He carried with him PowerPoint slides from a 2007 BARDA and Office of the Assistant Secretary for Preparedness and Response presentation. These included a table that showed in the event of a pandemic, the U.S. would need 5.3 billion N95 masks, 50 times more than what was in the national stockpile. "The world just looked at me as a mask salesman who was saying the sky was falling," complained Bowen, "and they would say, 'Your competitors aren't saying that in China.'" He was encouraged when Trump was elected because of his boasts of putting America first and his focus on domestic business. He wrote a letter to Trump at that time stating, 90% of the United States protective mask supply is currently foreign-made. He also made a call to Bright, as he felt he was one of 4 people in government who understood the issue. But Bowen lost a $1 million military contract to a supplier in Mexico. He wrote in August 2017 to a senior official with the Pentagon's Defense Health Agency, saying, "Shame on the Department of Defense. One of these days the U.S. military will need America's manufacturers to help win another war or fight another pandemic, and they will not exist." In January 2020, his orders ramped up, and he noted it could mean trouble. On January 20th, the Department of Homeland Security was looking for masks for airport screeners. He replied he didn't have enough in stock, but it led him to contact Bright and inquire, is this virus going to be problematic? This led him to send an offer to Laura Wolf, the director of the HHS's Division of Critical Infrastructure Protection. "This is not something we would ever wish to do and have no plans to do it on our own," he wrote. "I'm simply letting you know that in a dire situation, it could be done." Bowen's multiple warnings led Bright to ask his deputy to look into whether BARDA could divert money from vaccines and other measures to buying masks. Yet Bowen claims, "No one at HHS ever did get back to me in a substantive way." One person who listened was former Trump advisor Steve Bannon, who invited him to be on his podcast on February 12. "What I've been saying since 2007 is, guys, I'm warning you, here's what is going to happen, let's prepare," said Bowen, "because if you call me after it starts, I can't help everybody." This led to contact with Navarro, and Bowen thought then he was finally being heard. Bright's complaint said that he and Navarro began pushing the message that masks were a top priority. A month after his initial offer in January, Bowen received a 5-page form letter from the Food and Drug Administration. He suspected it was sent to many manufacturers. It asks how his company could help with a national emergency response to the PPE shortage. He wrote to FDA and HHS officials, pointing them to a government website showing approved foreign manufacturers of masks. There you'll find a long list of approved Chinese respirator companies, he wrote. Please send your long list of questions to them. $600 million was spent on mask contracts. Corporations like Honeywell and 3M received contracts over $170 million in total for PPE. A distributor of tactical gear, with no history of medical equipment, received a $55 million contract for masks, as much as $5.50 for each. This is 8 times what the government had been paying a few months earlier. FEMA finally awarded Bowen's company a $9.5 million contract to provide 1 million N95 masks each month for a year, an amount that can be fulfilled without the need to activate the dormant manufacturing lines. Prestige is charging just 79 cents a piece.